Hello everyone, myself Sachi Kulkarni, roll number 189. My today's topic is intravenous drip setting. Intravenous drip setting is used in conditions in which IV fluids are used are either to maintain the daily intake, number 2 to rehydrate a patient when oral intake is not possible, in acutely ill patients during emergencies like hypovolemia like occurs in case of hemorrhage, burns, diarrhea and vomiting, for drugs having short plasma half like in plain insulin and oxytocin. Now, what is intravenous bolus and where is it used? An IV bolus is used in non-emergency situations that still require a quick dose of nutrients to be delivered to the patient. What are the benefits of IV bolus? Number 1, as compared to the IV drip is long dosing. That is, it takes hours to empty the bag and replenish the body fluids and nutrients. But that is not the case with IV bolus. It works more quickly, sometimes within 5 minutes only. Where is IV bolus used? Examples in chemotherapy drugs like doxorubicin and vincristine, in antibiotics like vancomycin and meropenem, antifungal drugs like amphotericin and micafungin, and in pain relief medications like hydromorphone and morphine. An intravenous bolus is given over 5 to 10 minutes in 10 to 20 ml of isotonic saline or distilled water, example in calcium gluconate. Now, intravenous infusion. Intravenous infusion is defined as when more than 100 ml of fluid is given by IV route at a specified rate. It is called as intravenous infusion. For example, if we take 5 microgram per kilogram per minute of dopamine infusion in larger volumes, for example, if we take injection ringer lactate at a rate of 1 liter per hour for 3 hours in case of dehydration, then IV fluids are also used to deliver a drug slowly by the intravenous route when a bolus injection is not possible. Now we have to give intravenous infusion to the patient. So the equipments required are number 1, non-sterile gloves, number 2, tourniquet, number 3, antiseptic solution, that is 2% chlorhexidine in 70% isopropyl alcohol, local anesthetic solution whichever is available, number 5th, 1 ml syringe with 30 gauge needle, 2 by 2 inches gauge, 7 venous access device, and 8th, vacuum collection tubes and adapter. Here is a picture showing the various equipments required for intravenous infusion like gloves, tape, dressing, example Tegaderm, then IV fluid bag, drip set, gauze, tourniquet, alcohol preparation, IV catheter, connector tubing, saline flush. Now, conditions in which IV is used is serious infections. If a person get any serious infection, then the person can be treated with intravenous infusion. In cancers where we have to give chemotherapeutic agents through intravenous infusion, the drugs which have to be delivered are to be given by intravenous infusion. Number 3, dehydration. What happens in dehydration is that a person is unconscious at some stage. In initial stages he is not unconscious, but if the patient becomes unconscious in dehydration, then we can administer fluids into his or her body by intravenous infusion route. In case of gastrointestinal diseases or disorders, number 5th in congestive heart failure, 6 in Crohn's disease, 7 in hemophilia, and 8 in immune deficiencies. What is the procedure? Number 1 is gather the supplies like sterile IV catheter cannula, IV solution bag or bottle, sterile gloves, alcohol swabs, tourniquet, adhesive drapings and tape, saline flush, and patient's chart and medication orders. Now second step is prepare the patient. Like we have to explain the procedure to the patient and obtain the informed consent. Number 2, we have to select a suitable vein. Actually the most common sites which are preferred are the hand, forearm and antecubital area. Now third is position the patient comfortably and have them raise their arm on a surface. Number 3, hand hygiene. We have to perform a proper hand hygiene and wear gloves to maintain the sterility. Vein assessment and inspect the selected vein for signs of inflammation, thrombosis or other tissues. 5th, tourniquet application. We have to apply a tourniquet proximal to the selected insertion site to make vein more visible and accessible. Number 6 is vein distension. We have to ask the patient to open or close their fist to help vein stand out, or you may tap the area gently. Number 7 is catheter insertion. 8. Secure the catheter. 9. Tubing attachment. 10. Prime tubing. 11. Adjust the flow rate according to the requirement. 12th, we have to start the infusion. 13. Monitor the patient. 14 is documentation, and 15 is removal of gloves and dispose. Now we have to prepare the drug. So what we will do? Number A is dissolving the dry medicine. Number 1, disinfection of rubber cap of vial containing dry medicine is important. Number 2, select the appropriate syringe with the required volume of the solvent. Number 3 is insert the needle into vial holding it upright. Number 4, aspirate as much air as the amount of solvent already in the syringe. And number 5, inject only the fluid into the vial and not the air and shake it well. What will happen if the air goes? The air will go inside the patient's body and it can lead to serious complications. Now, aspiration of the drug solution into the syringe. Number 1, use a syringe with a volume of twice the required amount of drug solution. Suck up as much air as amount of solution needed to aspirate. Insert needle into the vial. Turn it upside down. Pump air into the vial, which creates a pressure. Aspirate the required volume of drug solution from vial. Make sure the tip of the needle is below the fluid surface and no air enters the syringe. Number 6, remove any air from the syringe. And in case of ampule, if we take an ampule instead of vial, then first remove the liquid from the neck of it by flicking it or breaking it. Now file around the neck of the ampule. Carefully break off the top of the ampule, and for a plastic ampule we have to twist the tap. Then aspirate the required volume of drug from the ampule and remove any air in the syringe. Now, what are the guidelines regarding addition of drugs to IV infusion? If any drug is added to an infusion, the mixture should be made immediately before use. If more than one drug is added, it is necessary to rule out a drug interaction. Example, heparin and benzyl penicillin should not be mixed, otherwise it can create complications. When drugs are given in this way, diluted in the IV fluid, they may lose their potency. Examples are benzyl penicillin loses activity. As already mentioned, heparin and benzyl penicillin should not be used. Why? So benzyl penicillin loses its activity after 16 hours in normal saline or 5% dextrose. Ampicillin loses its activity after 8 hours in normal saline and 4 hours in dextrose. Heparin is stable for 24 hours in normal saline but loses the activity rapidly in dextrose, and when added to infusions containing either antibiotics, hydrocortisone or sympathomimetics. Insulin is stable in normal saline or dextrose. 20% is lost by binding to reservoir and tubing. Now, drugs should not be added to blood and blood products. Example, hypertonic mannitol, irreversible crenation of RBC, dextran Rolex formation. We do not use plastic tubing for glyceryl trinitrate, paraldehyde and lactical. Choice of appropriate vehicle like that of infusion fluid. Phenytoin in normal saline, amphotericin B in 5% dextrose, adrenaline or noradrenaline or dopamine, prefer dextrose containing fluid. Certain special considerations like continuous infusion, aminophylline, dopamine and cisplatin, intermittent infusion in case of amoxicillin, ampicillin. We have to protection from the light in case of nitroprusside, and layering effect of potassium chloride due to density. Shake thoroughly after adding. So this was my point of view on intravenous drip setting. Thank you.